Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin today, I want to advise everyone of a change we're making to the regional status map on alberta.ca to better reflect our provincial path forward plan. As a part of this, we are currently taking province-wide steps to ease measures. Because we are taking a provincial focus right now, we've removed the color-coded regional status map and have removed the region classifications of enhanced, watch, and open. Albertans can still use our online information to see the active case numbers, active case rates, and population of their communities. We are looking at trends both provincially and regionally to assess the impacts of the steps being taken and to monitor for any change in trends. We will explore more targeted action if needed, either easing or tightening of measures at the health zone level, should circumstances warrant this in the future. Turning to today's update, we have now administered more than 120,000 doses of vaccine in the province. More than 29,000 Albertans have been fully immunized with 2 doses. Over the last 24 hours, we have identified 269 new cases of COVID-19 and completed about 6,200 tests. Our positivity rate currently stands about 4.3%. The R value in Alberta over the last week was 0.87, meaning our cases continue to trend down. There are currently active alerts or outbreaks in 313 schools, or about 13% of all schools in the province. These schools have had a combined total of 844 cases since January 11th. Hospitalizations continue to decline, which is positive news as it relieves pressure on our healthcare system. There are 432 people in hospital, including 76 in the ICU. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the loved ones of these individuals and anyone who is mourning a death right now, no matter what the cause. Since Friday, we have identified 25 additional cases of COVID-19 variants. This brings us to a total of 96 B117 cases, 46 of which are not currently linked to travel. To date, there has still been no spread identified in schools, and we continue to test widely. As I mentioned last week, we are screening most, if not all, positive tests every day for variants of concern. On days like today, our capacity to screen for variants exceeds the number of new cases of COVID-19 that have been identified. Today, we are officially moving forward with Step 1 easing of restrictions in the province. On Saturday, we announced that limited group physical activity for young people would now be included in Step 1. There are many factors that are considered in these decisions, such as the impact of current restrictions on children's mental health and the important role physical activity plays in children's development. When considering the various factors, given the lower risk of transmission in children, and given that school-age new daily cases have continued to trend downwards since reopening in-person learning, it was decided to add this additional option for children into Stage 1. While children and youth will be allowed to participate in limited sport and related group physical activities, we are keeping measures in place to reduce the risk of transmission. This includes requiring physical distancing among players at all times, masking, and limits on the number of people who can participate. This change was made to support the overall health and well-being of our young people, while still guarding against the spread of COVID-19. We consider all evidence from within Alberta and around the world as a part of each decision. However, I want to stress to the parents, players, trainers, and coaches that it's vital that every public health measure be followed at all times. This is the only way to protect the health of everyone involved. This advice is true for all of us, As we move forward, I know that many Albertans are excited about being able to eat in restaurants and enjoy other activities that are now possible. However, it remains important that we all keep being careful and keep making safe choices. Each of these activities must still follow all other protocols and public health measures to reduce the risk of transmission between participants. Now that we've started step 1, I know many are wondering when we will move to the subsequent steps in the Path Forward plan. But it's too soon to talk about step 2. We deliberately built in a minimum of 3 weeks between steps to allow us to monitor our hospitalizations, as well as our positivity rate, new case numbers, and overall growth rate, to ensure that we're not seeing a rise in transmission linked to activities that have been opened. This is especially important now that we have seen some cases of the more contagious variant strains in our province. We need to keep a close eye on these cases and take further action to prevent spread if we see these numbers grow. The reality of this pandemic is that there are very few risk-free ways to live with COVID-19 widely circulating in the province. Our public health measures are effective risk mitigation tools to help minimize spread of the virus and to protect our provincial healthcare system. But each Albertan needs to assess the risks for themselves and their families and determine what they are comfortable with, within the limits of the legal requirements and orders in place. Before we ease additional restrictions in the coming weeks, we all must be serious about following the guidance and measures in place to prevent cases from spreading. There have been recent events in some faith gatherings that indicate some are not taking these measures seriously. I want to reinforce these measures are mandatory, not optional, and that in Alberta we have made great efforts to make sure that faith communities can continue to meet in a safe way. Those who are not following current restrictions are breaking the law. Masking and physical distancing requirements will continue to be essential parts of our path forward in all settings, as will staying home if you're ill and isolating as required. As tired as we may be of hearing about them, these principles must remain top of mind in our daily routines and activities. The phased reopening of activities and opportunities will only succeed if all of us, no matter where we live or work, continue to follow the health measures in place and make choices to keep slowing spread of COVID-19 across the province. We must work together to make this happen. Thank you, and I'm happy to take your questions.
All right, we have a very full queue, but we will try and get through as many as possible. Operator, could you put through the first caller, please?
Thank you. Yes, the first question is from Jeff Slack, 660 News.
Hi there, Dr. Hinshaw. Thanks for taking my question. With the recent rise in the variant cases, do you believe that this will become the dominant strain that we're going to see going forward?
Whether or not the variant strain becomes the dominant strain depends, of course, on our collective adherence to the public health measures. Right now, we're seeing on average less than a 0.5% of our cases on any given day coming from variant strains, and some of the cases we reported over this past weekend were cases that had previously been diagnosed and were just screened for variant on the weekend. So it's important to remember again that these cases are a trend over time. It is concerning that we're finding more of them in the community without links to travel, but some of these are linked to each other. So we are seeing some limited outbreaks where we're able, because of our testing protocols, to put in enhanced measures to stop the spread of these variants from moving further. We are at the moment pursuing a containment objective with the variant, and so we have put in additional safety precautions. We've dedicated a highly experienced contact tracing team at Alberta Health Services to mitigating spread of the variants, and we are making sure that additional steps such as double testing of close contacts and additional isolation measures are in place, as I've discussed last week. So it's not inevitable that the variant strain would become the dominant strain. It really depends, again, on all of us and continuing to work together to prevent the spread.
Operator, can you put through the next caller, please?
Thank you. Jesse Weisner, Global TV.
Hi, Dr. Hinshaw. Thanks for taking my question. Wondering what changed between Thursday and Saturday morning to prompt the move to allow more youth sports. Alberta Health says the move was made based on feedback that was received. So was it based on public pressure?
When we've made decisions about the different measures that we've put in place, there's always been an attempt to balance the harms of COVID-19 that we want to prevent against the harms of restrictions. And the evidence that was presented was related to the impacts of the restrictions on children's overall health and the impacts on their development. And there was a reconsideration of that so that the group physical activities with the additional precautions that I've mentioned would be moved into step one to allow that support for our children and youth and their overall well-being.
Operator, can you put through the next question, please?
Thank you. Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. I'd like to follow up on the last question you were just asked. Many community associations followed your guidance last week and took out their ice or started returning sports fees to parents before the unexpected Saturday announcement that youth sports leagues could hold practices. Do you regret the mixed messages or the confusing change on a weekend?
It is unfortunate, of course, that the direction was not given or the information was not provided further in advance to allow for planning, and I understand that that is inconvenient and in some cases expensive for those organizations that have made those choices, and I'm sorry for that. What we have tried to do all along throughout this pandemic is to, again, balance those different considerations of making sure that we're minimizing the impacts of COVID and at the same time the impacts of restrictions. And so when we have made adjustments like this with a shorter time frame, recognizing that unfortunately it will impact some negatively who have already made those decisions, it is done with an attempt to create the greatest good for the most people.
Operator, can you put through the next caller, please?
Thank you. Aaron Collins, CBC.
Thanks for taking my question. Dr. Hinshaw, do you know if there are any cases of these new variants connected to meat processing facilities in the province? And if so, how many?
Not to my knowledge. We have, again, expanded our capacity to be able to screen every positive case of COVID-19 for variants, and I'm not aware of any cases linked to meat processing.
Operator, could you put through the next caller, please?
Thank you. Elise Stolte, Edmonton Journal.
Hi, Dr. Hinshaw. The Edmonton Journal is putting together a community-driven guide to the vaccine rollout. So far, we've heard from more than 200 seniors and those who care for them with questions. Of course, they want to know when they can get the vaccine, but they're also saying that even with no date, they'd like a plan, not knowing how they'll sign up, where they'll get the shot, or even how they'll hear about it. That's creating additional anxiety, and they're worried they'll miss something. Can you explain why you haven't released that level of detail to date? And when can they expect to hear the plan?
I understand it's frustrating and that people do want to know, even if they don't know an exact date, what will happen when that program rolls out. As we've had very sudden and dramatic changes in our vaccine supply, we've had to go back and make adjustments to our plans for rollout. And we're looking right now at how we can most efficiently provide vaccine to community seniors 75 and over. And those plans are being finalized. I know that there's many who want that information as soon as possible, and we're working hard to be able to get that out to them. But at this point in time, again, it's related to the changes in the supply, and much of the work on operationalizing all the different steps of the rollout has been focused on amending the plans and moving forward with adjusted plans based on the changes in supply. So again, we are working to finalize those plans so that it's available for community seniors and those who care for them as soon as possible.
Operator, can you put through the next question, please?
Thank you. Pat Sedlecki, CJOC.
Hi, Dr. Hinshaw. Thanks for taking my call. A quick question. I know that you said that there's 3 weeks in between each step, but say things continue to go really well over the next 3 weeks and all of a sudden we hit 300 by the 29th 300 hospitalizations by the 29th of February, do we automatically skip to step 3, or does step 2 kick in before we go down to that next step?
The current plan is to take each step as it comes. Of course, we will continue to watch closely and determine if any adjustments need to be made. But I want to make sure that people are very clear that it's not just the hospitalization number that matters, it's also our trends of positive cases, positivity. And it's really important that we collectively continue to keep our positive cases trending downward, because even if we have the hospitalization numbers that we might need, if our cases are going up and if they're starting to increase in a concerning way, then there may be a need to delay any kind of future steps, or we may actually need to take a step backwards depending on those new case trends. So I just want to make sure people are watching not just the hospitalization numbers, but also our new cases, our reproductive value, and our positivity rate.
Operator, can you put through the next caller, please?
Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. Can you tell us whether there have been any hospital admissions of people who have variant cases, if there's been any severe outcomes? And given the number of hospital outbreaks that we've had, what extra precautions hospitals are taking should variant cases be admitted?
I don't know the exact numbers. I know some cases with infection with the variant strain have been admitted to hospital. I don't know how many exactly. And I know that Alberta Health Services has applied the same rigorous protocols to these strains. As you mentioned, we have previously had some hospital outbreaks, and their learnings from those have been applied to ongoing day-to-day operations in acute care. At the moment, it's not clear whether there does need to be any additional precaution that is put in place in an acute care setting, because the current precautions and the requirements for how to manage cases are quite high. But of course, we're looking to see if anywhere in the published literature there is any need to make any adjustments. And if there are, we will absolutely make that recommendation.
Operator, can you put through the next caller, please?
Thank you. Julia Wong, Global News.
Hi, Dr. Hinshaw. Youth sports did not meet the initial criteria for step 1. So it sounds like the criteria are a moving target. I'm hoping you can speak to that. And will the data showing that this is a safe move be released to the public?
I want to emphasize that the decisions about how we put activities in different steps are based on the risk of that activity, as well as looking at the overall balance of the benefit of those activities to our communities and the risks of COVID-19. So the data on the risk of the activities that were now in step 1, so those group physical activities for children, that data remained constant. There's no change to that data. So the shift was really looking at the other side of that equation and the significant impact that the ability to do these kinds of activities would have on children's mental health and their development. And we have made sure that the precautions that we're putting in place, along with this new ability to do group activities, are more stringent than what was previously in place in November before these activities were paused. So again, that particular risk level is very similar. What we did see in the fall with respect to transmission within groups, in changing room or dressing room interactions, in social interactions, perhaps on and off the field. And so some of our requirements for this new step are that participants must remain distanced by 3 meters inside or 2 meters outside, that there are no spectators, that there's minimal use of any kind of changing rooms, and that participants arrive simply for the activity and leave directly, and that there's no socializing. So those are the steps that have been taken to minimize the particular activities that were deemed to be a risk when we had sports activities happening in the fall.
All right, there's one question left. So operator, please put through the final caller.
Thank you. Lauren Pullen, Global Calgary.
Pardon me, I didn't take myself off of mute there. Hi, Dr. Hinshaw. Thanks for taking the time to answer my question. I just want to touch base a bit more on the variants that have shown up and the 25 marks since Friday. Can you take me through your level of concern now that, as you mentioned, there is community spread? We have several cases that don't have known links to travel, and we are, again, beginning to reopen, and we're not quite sure yet exactly how much of these new variants are out in the community. When and how will that be assessed as to our plan moving forward in terms of trying to get this under control while still concentrating on those livelihoods and letting everyone ease a little bit?
We continue to monitor not just the variant, but our overall COVID-19 cases and transmission rate. And if we start to see the variant spreading more widely, that would impact our overall COVID-19 numbers and that transmission rate. So it's all part of that same package. I am concerned about the variant. I'm concerned about the numbers that we're seeing. And at the same time, I am grateful for the work that our lab has done so that we are able to capture the majority, again, if not all of these positive cases, able to screen them and able to do our more intensive contact tracing, more intensive case investigation, and more intensive containment measures so that we limit the chance that these might spread further. It's really important to remember that the numbers that we're producing with respect to Alberta are the ones that we're finding because of our very aggressive screening program. And so when comparing to different provinces across the country, again, just to make sure that it's with that caveat in mind that what's being reported are those that are being identified. And so the numbers that we have, while concerning, also give us an opportunity to make sure that we are suppressing any spread and putting particular attention to minimize the chance that these variants spread further and become dominant.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.